Good morning, ladies.
Hi, Keo.
Well, my video is playing.
Tiffany, Bonnie mentioned that I could, oh, she's in that hazy filter mode. Bonnie mentioned that I could flip-flop my Zoom so that you can read the words on this poster. Do I want to do that? Like mirror image it? I don't know. It seems okay.
You may have to do that from your end because I can't do it for you.
Yeah. So.
Oh, here's Marisa, Alex. Shelly Kier, is that one of our co-hosts?
No.
Okay.
Your poster looks correct, Catherine.
Oh.
It's reading.
I didn't do anything. I didn't do anything.
Who's in hazy filter mode? Me?
No, Keo is like a little sneaky Zoom person.
No, it's just an old laptop.
Oh, I thought it was on purpose.
No.
You're like in portrait mode. Here, look at Keo. See those two papers that are like tacked up on that black thing behind you?
Uh-huh.
Yeah, you want to take those two papers down?
I can.
You can? Yeah, take them down because then I can focus on your eyes and not those papers.
How funny are you?
Sorry.
So you don't have the fan on your head.
I moved my setup here.
Well, it doesn't feel right.
Oh, stop it.
Hi, Alice.
Alice, two things I wanted to quickly raise, if these come out in questions, either for Alice or Marisa, that Keo just mentioned to me from last night. She got information. One, a waiver, a device waiver, liability waiver about, sorry, not liability. There's a COVID liability waiver that is happening, Alice. I don't know, you might get a question about that. And I've seen that, I've heard about that. Like we won't hold you liable if you get COVID at school. So just be prepared for that.
Oh, okay.
And I don't know what to say, but you know, figure that out. And then the second thing is the device, assuming responsibility for the device and, you know, a payment if something happens to the device and predicating giving the device on signing that paper. So just be prepared for that too, Marisa or whoever.
Hi, Marietta.
Hi, how are you? Good morning to all. Nice meeting you. Hi, Alice.
Marisa's going to be our moderator, so she'll, you know. And we're very low tech, so everybody's going to come up on Zoom. It's not like we're going to hide everybody, so I'll find you somehow. Can you guys hear my painters outside my window?
No.
How's this?
No.
How's the sound? I'm
Good.
Your sound is
sound
awesome,
good.
but your video is like delayed. But your sound is great. Your sound is great.
If she sits still, it's okay.
Yeah.
Is my video okay? I had to,
Yeah.
because my neighbor is building something and it's really, really loud and it's right outside our office. So like you can just see everything.
Me too. So,
So I'm in a different part of the house and I don't have like a cable to connect directly. So I'm using Wi-Fi. So it doesn't really go well.
you look great, actually. It's actually really looks fast.
So I need you to
Okay.
stay in the corner.
Okay, so let me just practice for a second, make sure I get this right. All right, Dr. Marietta Vazquez.
Yes.
Okay,
I made her pronounce it right.
Vazquez, I got that right. Okay, and Kiyomari Sotillo, did I get that right?
That's fine.
Okay, good. And
You
Wendy
find her right.
Say it again. I mean,
Sotillo,
it's Tomari, but that's, I'm okay with whatever.
Kiyomari,
Tomari.
Kiyomari. Oh boy. Okay, I'll try it.
No,
Kiyomari.
but you the first time it's fine. I work with that or Keo, whatever is easiest.
Okay, maybe I'll. Okay. Okay. Kiyomari.
Yeah.
All right, I got it. And it's Wendy Cardenas. It's just Cardenas, not Cardenas.
No, it's
Cardenas.
Cardenas?
Cardenas.
Cardenas. Okay, I'll try my best. Wendy Cardenas. Okay.
I don't know if we got to all of you, but Bonnie said that CTN wanted to broadcast this when we're done. Is everybody okay with that?
I'm okay with
Yes.
Wendy?
Yes.
Okay. Thanks, Alice. And then this is Tiffany, our amazing paralegal, who is going to sort of help do the background tech stuff. So she'll also be monitoring the chat box and stuff. So you guys just get to have fun. Thanks, Tiffany.
So we're gonna hold off on admitting people till 10. Yeah, okay. 6 people.
And do I have the controls to admit people when they start coming in?
I have it as Marisa, but let me change it to you then. Because I think when I share my screen, I won't be able to see you guys anymore or see the.
Tiffany, can you put me and Patricia?
Then I wouldn't. We can't have multiple. We can only have like a host and a co-host, so it has to be me and then plus one other person.
Okay.
I can toggle it later on when I take the slide down, so I can put it as Patricia right now.
Okay.
If that makes sense. And then I'll go back to you guys.
Oh, we already have 3 people in the waiting room.
Is
You
the
should
audio
see-
breaking up for you guys? It is for me.
No.
No.
Oh boy. My
Can you hear me?
signal must be bad. I can hear you now, but the person who was speaking before, I could barely understand.
But can you hear me clearly or no?
All right, if hear you clearly, yes.
Do you want me, if I can
The
always,
video just froze, but I guess if this is, I'll switch to my phone.
okay.
This
Yeah,
is
I'm
an
sure
all-female cast.
I was thinking about that.
All-female cast and crew, directed by a female, starring
That's
female.
awesome, by the way. Talk about. That's awesome. Thanks for noticing that, Catherine.
Yeah.
Trisha, you'll have to
Surprising
put the
nobody.
people in because I'm gonna share my screen in a second, and
Okay,
once I put it on presentation mode, I can't see anything.
no problem.
Okay,
Okay.
thanks.
2 people waiting already. Two participants. Why are you not doing your work? I'm starting. Oh my Lord.
Hi, Wendy. I just saw you. Hi.
Hi, Catherine. How are you?
Hey, how are you?
Good.
Wendy Cardenas. Can you say it again? Say your last name.
Cardenas.
Cardenas.
Oh my gosh.
Patricia, Marietta got disconnected, so can you just see for, oh, she's on again.
She's on?
Can you let her in if she's not in already?
I think I'm
Oh, you're in. Got it. All right, you're in.
Okay.
Marietta, you could also, if you want to, just keep your video off if that makes your connection better. Just a thought.
I can barely hear you. Are we live?
Not
No.
yet.
I could try to quickly go to the house next door and see if they have better Wi-Fi. My Wi-Fi signals, I'm worried this may not work. Or flip the order of things to see if I can, if you give me 5 or 10 minutes, maybe I can.
Is it better on your phone, maybe?
If you want to try with your phone.
Or you can just call in.
You could, that's always an option, calling in.
Or use the data on your phone instead of connecting to the Wi-Fi.
I think calling in is probably the safest bet.
Mm-hmm.
Yeah. We have about 43 people waiting. Just let me know when I can let them in.
Tiffany,
Yes.
do you know, so who has the controls, Patricia and you?
Mm-hmm. Mm-hmm. Do you need the
Okay.
number?
45.
Mm-hmm.
Yep.
Can you guys?
Let people in.
Can I let them in?
All right, we should probably go on mute. Can we
Marisa, if we can't find Marietta, you want to switch Catherine and Keo first?
Do you want to send me a text and let me know?
But
Okay.
Patricia, she's waiting to get let back in, Marietta.
All right. I'm just gonna, I'll just let everyone in then.
Yeah.
Oh, wait, I can admit her. I found her. She should be back in.
Okay, let's see. We're at 10:02.
Okay.
Okay.
Admitting
back.
everyone.
Can you hear me, Marietta?
I can hear you well.
Yeah, you look good. You look much better.
Okay, we'll do this by phone then.
Okay.
Thank you for the tip.
Okay, so we're going to stick with our order.
Yes.
All right. Participants are joining.
Okay, we're going to be getting started momentarily, folks. Thank you for waiting. Good morning and welcome to everybody to our Education in the Time of COVID Back to School webinar. Just a few housekeeping items before we get started and logistics. Please, everybody, keep yourself on mute throughout the course of the presentation. We do encourage you, however, to stay on video so we can see you if possible. We will be taking questions throughout the presentation and encourage you to put those in the chat box. We will try to take questions as they come up during the segments and look forward to hearing from you and keeping this engaging. If we're lucky, hopefully at the end, we'll have time for questions as well. Please note that the webinar is going to be recorded today and it will be available on our website after the fact. And after the conclusion of our webinar, everybody who's registered will receive a follow-up email with resources and links from today's presentation. So look out in your inbox for that. My name is Marisa Halm, and I'm an attorney and the director of the Team Child Youth Justice Project with the Center for Children's Advocacy. I'll be moderating the discussion today. I have the privilege of working alongside my colleagues, including those who you're going to meet today shortly, to provide education, representation, and advocacy for the children, youth, and young adults that we serve, who are most at risk in the state of Connecticut. I've been practicing law for over 12 years and 8 years with CCA. At no point in my career could I have imagined the challenges that we're facing to the rights and entitlements to a public education at this point in time during the pandemic. These challenges are particularly stark and challenging for those students that we represent, those who cannot otherwise afford legal representation. In reviewing the audience today, we see very many familiar faces and names and community supporters who also know the struggle that we're experiencing very well. And we're grateful that you're here with us today to engage in this discussion. We look forward to a rich discussion with all of you and between our attorneys and vested community partners here today. The Center for Children's Advocacy, we're also referred to as CCA throughout, is New England's largest children's rights organization. We're a nonprofit law firm providing legal representation and advocacy for children and youth who are most at risk. CCA's staff has offices in Hartford and Bridgeport, and we're located in community sites throughout Connecticut, including New Haven, Yale New Haven Hospital, and various schools. And our work brings us into the courts as well as child welfare and juvenile justice facilities. Our focus here today is one area of advocacy and representation that touches the lives of every child that we represent, education. CCA is privileged to do the work that we do, and we would not be able to do it without the help of all of our generous supporters and donors. We're especially thankful to the Office of Public Defender Services, who's supporting today's webinar and has made it possible. Before we get going on today's presentation, Tiffany, we can switch to the slide that shows all our presenters for today. We'd just like to provide a little backdrop. As you know, fair and equal access to a public education, which is a constitutional right here in the state of Connecticut, has been wholly undercut by the pandemic. Our goal today is to provide you with some insight from the field on how to best access education under these circumstances and share some advocacy tools and tips based on guidance that's available and our collective experience. What we know even more is the challenges are starkest and most difficult for the clients we serve, Connecticut's most vulnerable children in our under-resourced and urban communities like Hartford, New Haven, and Bridgeport. Although daunting, we do believe the current state of education provides the opportunity for us to imagine and transform public education to become more equitable and meaningful for all students, especially those who are most vulnerable. Children with disabilities, children with health needs, children with English language learners, all of which we're going to be talking about today. And we cannot in any way minimize the fact that the brunt of the children we are talking about are children of color. Prior to COVID, the opportunity gap that existed for these groups was wide. In the time of COVID, it's safe to say that this gap has been significantly broadened. We see it as our job at CCA to make sure that we close that gap alongside of our many community partners. We have the fortune of working collaboratively with many partners, including those co-presenting with us today, Yale, Make the Road Connecticut, and CPAC, as well as the Office of the Child Advocate, SEEK, AFCAMP, Legal Services, and many others to advocate for Education Reimagined. Other key partners include the Village for Families and Children, CHDI, and Clifford Beers, as well as the State Department of Education, who are hosting a webinar later today on mental health challenges in schools during the time of COVID. By now, most of our school districts are back to school. What we know is that this is back to school in the time of COVID is substantially divergent from what it was prior. This school experience varies broadly from district to district and also from child to child. For example, my pre-K and elementary school children who are in a magnet school in Hartford, where the district, where less than 40% of the district has opted to go in person, have an in-person education every day. Students in the city of New Haven, where the board there has decided to keep things virtual, have virtual education every day. In various other districts, students are experiencing what's called a hybrid education, where they are partially in person and partially virtual. The schedules for this hybrid instruction, again, varies broadly across district to district. And again, education varies child to child. Some children may have the benefit of in-person instruction supplemented by synchronous virtual learning at home. Others, maybe who are home because of family choice and family circumstances, are subject to spotty internet access and limited access to virtual education or synchronous instruction. We do know that all families have been given the opportunity to opt out of regular instruction and choose virtual instruction based on their own personal preference. This choice is a difficult one for families and students with disabilities, where it's generally recognized that in-person instruction is the best modality for students to learn and make progress. So here we are, we're back in school. Those who are in school have limited schedules, are wearing masks, are in pods, and are socially distanced in completely redesigned schools, watching on a daily basis the COVID case positivity rate, being ready to be poised for a shutdown at any moment. And then we have children who are receiving education at home virtually with varying access to their teachers and to instruction through synchronous learning, who are reliant upon unpredictable technology and internet access. For all of us at CCA and in the field, it continues to be and has been and continues to be a tremendous task to keep up with all of the guidance impacting education that's been issued by the governor and the State Department of Education. Things are changing regularly and quickly. We do know that the pandemic is not going to end anytime soon, and we have to be prepared to process that new information and pivot quickly so we can best advocate for our clients. Through today's discussion, we aim to share with you what's expected, what you should expect for your most neediest clients, and provide you with tips to advocate for them. Our panelists are going to address the medical perspective of what is reasonable to expect, as well as challenges facing families with disabilities and health needs, and providing an understanding and tips for families with English language learner needs. Throughout today's presentation, we aim to challenge you to think of ways to keep your clients and the students engaged. And we also hope to hear from you as to what you're seeing in the field and hear your questions about what you think is most important to advocate for the students that we represent. Without further ado, we're going to turn to our first group of panelists. I'm happy to say that I'm joined by my esteemed colleague from CCA, Attorney Alice Rosenthal, and Dr. Marietta Vasquez, a trusted partner from the Yale School of Medicine. They're going to discuss the safety of being in school at this time. They're going to talk about concerns for students with special healthcare needs, including the issues of mask wearing and potentially what to do if a COVID infection arises. Please remember, if you have questions for them, to put them in the chat box so that we can pose those questions to them. Alice Rosenthal is a senior staff attorney with the Center for Children's Advocacy. She's the on-site attorney for our medical legal partnership at the Yale New Haven Children's Hospital. She represents children and families on legal issues affecting children's health and well-being. Dr. Marietta Vasquez is a professor of pediatrics at Yale School of Medicine in the sections of infectious diseases, global health, and general pediatrics. As a clinician, she sees patients at the Yale Children's Hospital Primary Care Center and is the director of the Yale Children's Hispanic Clinic. She's received numerous awards throughout her tenure and has elevated the voices of many of Connecticut's most vulnerable students and families. And without further ado, I turn it over to them.
Thanks, Marisa, for that introduction. And thank you so much, Dr. Vasquez, for joining us from far away. It's a pleasure to see you as always. I just want to repeat what Marisa said, that we really hope that this webinar can feel like a guided conversation. So I have some planned questions for Dr. Vasquez, but also happy to take your questions as we go. And we'll leave a little time at the end of her section, and then hopefully at the end of the entire webinar. And as you know, and Marisa pointed out too, the last 6 months have been tumultuous and uncertain in so many ways, but particularly trying for those in the medical field. So I just want to take a moment to thank you, Dr. Vasquez, and all your healthcare colleagues for all you've done for our communities and for our families. We really couldn't do it without you, obviously. So thank you so much. When we think about when schools closed back in March, for the public health of the entire state of Connecticut, we had high infection rates and death rates. But because of all the great work that we did together as communities, those rates are now some of the lowest in the country. And so the governor and the State Department of Education has recommended reopening schools. And all the districts are doing it in various different ways. And so because of that, it's kind of hard to understand how to give guidance to families broadly, but they have issued some guidance. And so today, Dr. Vasquez and I are going to talk sort of from a medical perspective, what that looks like and where we are today, keeping in mind that everything changes literally day to day. And so it's hard to keep up with it all and know what the right answer is at any given time. But luckily we have colleagues and providers across the state who are happy to answer questions. So my first question to you today is, as a medical provider, can you just tell us a little bit about what the most common question or concern you're hearing from parents is?
Yes, thank you very much for the invitation. It's really a pleasure. Can you hear me well?
Yeah, really well.
Okay, it's really a pleasure to be part of this esteemed panel. The most common question was, should I send my child to school or should I not send my child to school? And it's a bona fide question, right? But I think what we're facing is uncertainty, and there's uncertainty everywhere. There's uncertainty for many individuals with regard to how will their health be impacted. There's uncertainty. There's political uncertainty. There is a lot of uncertainty even in our communities and how we approach each other, how we take care of each other. There's uncertainty with regards to our health. There's a lot of financial uncertainty with the jobs, especially in communities of color. And when it comes to schooling and when it comes to health, I think that as a population, we're very used to, and you're all attorneys, we're very used to kind of what the law is. So if your child does not go to school, you can be, it's truancy. So children have to go to school, and school is very regimented. Well, depending on where you live, if it's public education or private education, these are the vaccines that you need to receive. So in those two environments, there is a lot of, it's almost like getting on a roller coaster. You go where you're told to go. Now things are slightly different. And I think I always like to start with a disclaimer that I think this has a lot to do with uncertainty and how we deal with uncertainty. That what you're not going to get today is, and what I'm never able to give, is to tell parents, oh, tell me about your situation. Your child should do a hybrid, should go fully virtual, or should go to school 24/7 for the full school year. We need to understand that really the goal of the guidelines, and emphasis on the word guidelines, is to mitigate risk, not to eliminate risk. So I'm going to say that again. The goal is to mitigate risk. Nobody right now can tell any of us that our risk of infection is 0. So with that baseline understanding, then we approach the question, should I send my child to school? And what I start by saying is that school is really is fundamental to development for young children, for adolescents, and for many adults in our state of Connecticut who have adult ed. And it's fundamental, but it doesn't necessarily need to be in person. It's education in and of itself. It could be virtual, it could be in person. And right now, in terms of making a decision, I think that you need to make the right decision for you and for your family. And there are a few steps that I talk about when I talk to families. Gather information. Don't just say, well, I'm going to say yes to homeschool or school in person, if you don't have the information. So school systems, I think, in our state have done a relatively good job at keeping parents informed. So find out what the strategy is for your school system. Talk to your pediatrician. Find out the reality for your family and for your child, taking into account, I mean, there are a lot of factors. The bottom line is that each decision, there's no one size fits all, and that if you, with the information in hand, make a decision that you feel relatively comfortable with, understanding that there will be a risk. There will be a risk if your child does not go to school. There will be a risk if your child goes to school. Then that's the right choice for you and for your family. So, again, I'm used to, you come to me, you have an infection, I'll give you an antibiotic and I'll treat it and I'll make it go away. These are different times.
Yeah, that's definitely true. I know as a parent of 2 kids myself, it's a very confusing and scary time. And I think you're right, it's an individual decision. But what about for kids who have special healthcare needs or have more heightened immunity issues? Are there additional considerations that families should think about? Or that schools should be putting into place to ensure those kids are safe?
Yes, the process is very lengthy, and I think that as a medical provider, I should be aware of what the process is in the schools in my area, the schools where my patients go. I think as parents should know this. As healthcare providers, mental health providers, legal providers, we should know. You need to know what the issues are. So, for example, if we say, well, does the child have a comorbidity? Saying yes or no to that question does not preclude the child from being in a school in person. There are some comorbidities, for example, children with cancers, children with severe immunodeficiencies, children who have diseases that put them at increased risk for viral infections. Those children probably should be looking at a virtual program. But for example, something like asthma, that's one of the most common chronic diseases that children have. Well, the data that we've seen is that even though asthma is regarded as a chronic respiratory infection, having asthma is not a contraindication to going to school because it doesn't lead to an increased risk. If you're home, you're probably not going to be exposed to that many individuals, correct? But on the other hand, if somebody in your household does bring COVID, and you're in your house 24/7, the exposure is going to be higher. So I think these decisions should be made in conjunction with their health provider. That's in terms of physical comorbidities. There are many other challenges for children. For example, children who are in the pervasive developmental spectrum, children with autism. Autism is a spectrum. There are sort of different levels. For some children, it's just impossible for them to keep a mask on, and it poses a challenge for them, but I think mostly for other kids in the school system. And that's where you want to have the conversation with the school. It's important to know what are the necessary, is the school system taking the necessary steps to spread COVID? Are they following CDC guidelines? Is that plan in harmony and in direct contact with the Department of Public Health? Because the Departments of Public Health and Departments of Education also have guidelines. How well are the families involved in the process? If maybe a very occlusive mask can be worn, can they keep the social distances? Is the school abiding to the increased level of cleaning that now the schools need to be under? Do they have the staff to accompany these youth with special needs, which obviously all of them have paras, but they may need additional staff to try to really keep the physical distancing. So, I think the children with special needs pose an additional layer of complexity, but socialization for them and education for them is just as important as the mainstream kids.
Yeah, absolutely. And I know a lot of people on the call today know this already, but you can always look to work with your school around ensuring that they make the right accommodations as long as they're reasonable. And so I think that can be a really important conversation to have with your child's teacher, with the school, and then obviously with the district. And if you're finding that that's not working at that level, you can always file a complaint with the State Department of Education, depending on what the situation is, or obviously call any of us. But there are accommodations that schools can put into place. The addendums from the State Department of Education, it's Addendum 11, talks about face coverings, but mostly that, I think what I'm hearing from you, Dr. Vasquez, is that masks are really important to lower the risk, but we're never going to erase the risk. But if a child can't wear a mask, that we do need to think about what are alternative ways, either rearranging the classroom or coming up with different ways of mitigating that risk, like you said earlier. And so definitely, I know that's a controversial thing that's come up. And recently, the State Department of Education issued new FAQs to sort of address the mask and face covering. So if people are interested, you should definitely check that out, because they did give a little bit more clear guidance to districts. But like Dr. Vasquez said, it is totally individual to each individual child, family, and then the school that they're working with and how they can mitigate those. One other thing.
Can I ask one more thing, which I think it's important, that the policies that are in place must be flexible and nimble and respond to new information. That's a very important point. And also transparent. So flexibility and transparency are very important, because there's the child with special needs, but there are also the other children, and the parents need to know what these policies are, and that if there is a case, which I am telling you all right now, there will be cases. There are already cases, and we've only been, with this hybrid model for a while. That I would want a school setting that is flexible enough has already in place alternative plans. Because the plan may be very different, but you don't want to say, oh my God, now we have 10 cases. What do we do? And I'm, all the school systems that I know of, and I have 3 children in different school systems. 2 in college and 1 in our local school system. I know that they already have several contingency plans. So I think that's also important to know.
I think that's excellent. And you started off by saying that too, Dr. Vasquez, about, normally we go to school and there's rules and they're very rigid and this is how it runs. And then this happens at this period. And this is how dismissal happens. And a lot of that has totally been upended, and it is totally about flexibility. And I think sometimes those of us in the advocacy world see schools as not always being so flexible or individualized to families. And so that was a great point. Really love that. Now that flu season is about to start, is there anything we should be considering or families should be thinking about in terms of staying in touch with their primary care doctor and anything that you want to put out there about flu season and keeping up with your doctor?
Yes, I thank you for that question. I think it's very important. We all need to remember that because COVID is the buzzword and the infection and the biggest problem, probably one of the biggest problems of our lifetime, that other diseases do not take a break, that we will have we're still having all the other infections and all the other problems that we were always having. And that really underscores the importance of continuing with your preventive and treatment cares for things other than COVID. Unfortunately, what we've seen is that because of what we lived in the last 6 months, many, especially children and vulnerable individuals, were not keeping up with their routine appointments. The offices were closed. People were scared of going into the medical offices. And right now what we have is we have a population of children where about 40% are delayed in their routine immunizations. So going back to the drawing board, understanding that, getting back to that uncertainty, there's a lot that we can't control. We don't have a COVID vaccine. We don't have a treatment that will just erase COVID from our vocabulary. But we do know how to prevent chickenpox. We know how to prevent measles. We know how to prevent the flu. We know how to prevent pneumococcal pneumonia. So please, 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 all of us need to know that, instill that in our family, and make sure that our children, that ourselves, go back to our medical providers and tell our clients and our patients it's time to make appointments and come back, and really make sure that all of those treatment and preventive strategies that we were supposed to have, we continue with them. With regards to flu, I think more than ever, getting the flu vaccine this year is very, very important. Both COVID and influenza are viral infections. They both infect primarily the respiratory system. Their presentation is very, very similar. So you can imagine being a physician in an emergency room, and once the flu season starts, which will start very soon, you're not going to know who has flu and who doesn't. And you might say, well, I don't care. Well, we should care, because the individual who is infected with influenza and develops COVID on top of it is going to, that person's chances of ending up in the hospital and dying is enhanced. And the corollary is also true. Somebody with COVID who happens to, let's say an adolescent who's asymptomatic in college, gets infected with flu, their chances of having severe disease, morbidity, and mortality is much higher. So let's protect our population from the viral infection that we can protect against. Very similar to what we were talking about in schools, we need to see, is there a face covering policy? Do they have cleaning protocols? Is there distancing? Are they doing testing? What about their ventilation system? Do they have a plan in place for if there are cases within the school or within the practice? Medical practices have these protocols in place. So even though,
you might think that there's an increased risk from going to your doctor's office. The benefit from going to your doctor's office and getting the preventive care that you need offsets any small risk. All of the, by now, what we've gotten very good at, especially in a state like Connecticut, where people tend to follow the guidelines, is we're very good at our preventive strategies. So I'm sorry this was sort of a little wordy, but I think it's very, very important. We are working at Yale New Haven Hospital. We have a task force, and it's a beautiful collaboration between the Department of Public Health, the New Haven Public Health Department, the hospital, the school system, the school nurses, pharmacies, and we're gonna work very hard to have drive-through vaccination clinics, to start a quick flu clinic in the waiting areas, to have them in communities. In our pediatric department, we started with some of the pediatricians I work with, we started a medical van where we bring care. Instead of having the patient come to medical care, we are going to the communities. I do immigration health. You know, for me, the underserved community in our New Haven neighborhoods are very important, and they're the ones who are mostly affected by the infection, both in the financial sense and also in the medical sense. So bringing care to them is very important. So there are a lot of strategies that are in place or in the works, but people need to know about it. We need to do better at educating. We need to try to tackle polarization. There is what we're seeing, and we had grand rounds yesterday in our department, which was just phenomenal, because the speaker really talked about how your care is completely polarized and politicized. Healthcare should have nothing to do with politics. People are dying. This is a very, very serious disease, and we should take it. We should look at data. And if, you know, if our patients, if our parents, if our students, if our clients have questions, don't just say, well, that question comes from the left or the right wing. Just listen. Let's listen to them. And if I don't know the answer, I'm going to call Alice, because she's my friend and expert, and she knows what she's talking about. And for the things that she may know not the answer, she will get me an answer right away. So that's why I think these events that you guys put together are just phenomenal, because you bring in people from different areas talking about one topic. If it's just doctors talking about amongst us, we're really not going to be effective in talking to parents and talking to everybody, to all the groups around the table.
That's a great point. Our section, we ran out of time, but I think it was a great moment to say one lesson that maybe is a positive from this is that we finally are turning back to public health and hopefully to science for those of us who believe in science, to partner, to say that, you know, the schools shouldn't have to be making these decisions in their silos, and the doctors shouldn't have to be just guiding families in their silos, and that if we can work together and partner, it'll be better for kids and for children's health. So thank you so much, Dr. Vasquez. I don't see any questions in the chat, but if you can stay on, that would be great. And I really can't thank you enough for participating. I know you have a lot of busy stuff going on, so thank you.
Thank you.
Yes, thank you very much, Dr. Vasquez. I really appreciate it. I think everybody really appreciated your input. I also wanted to just bring up, you brought up a very key point around truancy, and you know, how normally if students are not attending school, they're considered truant. But now in this time of COVID, where students are receiving schooling, many of them either through the hybrid model or the opt-out at home model, through being at home, the whole concept of truancy needs to be reimagined and redesigned. We're actually currently awaiting guidance from the State Department of Education on that very issue, and it's our understanding that'll be coming out by the end of this week. So we will be on the lookout for that and sharing information from that with all of our partners. Now we get to turn to our second segment, and we're going to have a chance to hear from one of CCA's in-house education experts, Attorney Catherine Meyer, along with one of her in-the-field partners, seasoned parent consultant, Kiamati Sotillo from CPAC, and they've both been working with parents of students with disabilities for over 10 years. They're going to talk about the difficult challenges some of our most vulnerable students are facing at this time, including access to virtual education, issues around IEP implementation, and the convening of PPTs in this new time of COVID, as well as other tips. Attorney Catherine Meyer directs CCA's Educational Success Project, which provides legal help and support to children and youth in school. She has co-counseled a variety of systemic and legislative efforts, including statewide complaints, Office of Civil Rights complaints, and legislation concerning the education of Connecticut's most vulnerable children. Kiamati Sotillo is a parent consultant and advocate who's been working with CPAC, the Connecticut Parent Advocacy Center, for 10 years. In her work, she supports families who have children with special needs, and she teaches them how to advocate for their children and does so alongside of them. She also is the parent of 4 boys, 3 with disabilities, including 2 with IEPs and 1 with 504s. So she brings her personal experience to bear as well. And without further ado, I turn it over to them.
Thank you, Marisa. Hello, everybody. So happy to be here. This is a topic that couldn't be closer to our hearts. And Kiamari, I'm just so excited to present Kiamari to you, or have Kiamari share the floor with me. She's an amazing collaborator and colleague and friend. She has 4 boys and I have 4 girls. So we're living interesting lives here, but we're all living that personal and professional challenge of education and navigating it as a parent and as an advocate and attorney. The first thing I just want to highlight a few themes, and then we'll kind of get into our conversation. You know, these themes have been highlighted also by Marisa, but just to underscore what we're seeing, particularly in the field of special education. Equity issues. Systemic racism underpins our educational funding structure. Let's say that as it is. And this situation has only exacerbated the effects of those structural problems. So we look to this situation to create urgency, to be innovative and creative, and to create something new. Not to go back to what we were before, as one of our colleagues, Andy Feinstein says, but to go on to something new and better, and to enhance that urgency. So that's the the challenge, but also the opportunity. The second thing that's kind of underpinning this all is the foundation of engagement, connection, relationship. Even if we are physically distanced, how can we still feel connected to our school community as parents and as families and as children? That's all these children are looking for, and that's all these parents are looking for. And that's the primacy of their needs right now. Through whatever modality, how can they feel connected and like they still belong? And the last thing is the challenge of allowing for flexibility while still demanding accountability, transparency, especially in decision making and all the different structures that serve our children. So knowing that this is, as Dr. Vasquez says, of course, an incredible period of uncertainty and needing to be flexible and nimble, but also maintaining standards and maintaining and demanding accountability for our families. So Kiamari, we could talk all day, so we're trying to keep it to the topics at hand, but we love to gab. First, so let's talk about a multi-part question. What are you seeing in the field in terms of parents' access, in terms of devices, connectivity, and also general communication with schools? Oh, you're on mute.
Sorry. I think it's the communication with parents, not really knowing how the child is either going to be able to access the technology, or knowing how to enter into the different platforms, navigating the different platforms. I think that's coming up. The consistency of communication, what's the modality? I mean, for some parents, they prefer a phone call, and some schools are just sending emails. or maybe they would like a text, but they're getting a phone call and probably the parents at work. So just trying to identify the parent's preferred mode of communication. So that, I think that comes up a lot.
Yeah, I think we know there's a lot of talk about access to devices and connectivity. It's an ongoing issue that continues to be raised, but really we're demanding to see results, and we're trying to see data that proves that this issue is getting better. So at the state and local level, we hear these kinds of things being rolled out, but we're still looking for data that proves that this percentage of students is now connected, this percentage is now engaged, and to see that we are moving in the direction we need to be moving in. And a lot of advocates and attorneys are framing access as, as a civil legal right at this point, because without that, you're not having access to education or medical care necessarily. So that's something we're really highlighting. And then you kind of bring up the issue, Kimari, which we talk about a lot, is even with the actual hardware, even with the wireless flowing the way it needs to, how can a parent learn how to use the devices properly? And this is even more pertinent for parents of special education students, because in many cases, they are a de facto part of the IEP now. They are supporting the delivery of special education related services, and they need to be even more looped into that equation. So can you talk a little bit about kind of the some of the struggles you're seeing parents have, but maybe also some solutions?
Sure, absolutely. So some of the things coming up with not having enough devices. So sometimes in the family, there's more than one child and they're sharing the device. There's the Wi-Fi lagging, that becomes an issue for families. Staying connected and engaged. If the Wi-Fi is lagging is really hard. I know I deal with it at home. I have 2 kids and myself, and we're using Wi-Fi. Not all districts have the one child, one device, so that becomes an issue. Wi-Fi becomes an issue, the strength of it. Also, parents not feeling like they're a part of the decision process. They almost feel like they're being left out, like this is what's in place and this is what you have to do. Also, language becomes an issue. So if the work that's being sent home is all in English and the family speaking Spanish, and the family is the primary supporter in the home providing this educational support, there's no one really calling and saying, hey, I'm going to talk to your kid, we're going to work this through. And some teachers only speak Spanish, so they're also trying to figure that out. We don't have enough bilingual staff sometimes in schools, and that's adding to the challenge and frustration for families.
Yeah, so just to underscore some of the legal solutions, the legal tools in this area. Students with special education needs have IEPs, and there is an opportunity to have parent training written right on that IEP. Even outside of that kind of formal tool, if a parent is supporting the implementation of an IEP, which I can't think of a parent that isn't, they definitely have the right to have an understanding and open dialogue and communication with the school. That is something that's a hallmark principle of IDEA, and that is something that the State Department of Education has continued to put out as a primary message in all of their guidance. And so I would draw your attention to Addendum 6, which is going to answer a lot of the questions that we're going to get into a little bit in our next segment. But that has been consistent from the start, is that parents still have the right to be in dialogue and communication and collaboration with school districts, and decisions can't just be made without parental input. I know you had also mentioned, just in terms of solutions, Kimari, that you've seen a school that kind of did this well. Can you talk a little bit about that?
Absolutely. So it's actually my kid's school, and I'm really happy to say that it's my kid's school only because they're benefiting from it. So they're really putting together opportunities to teach families how to use Google Classroom. So they're doing Zoom sessions. They're also doing in-person sessions, but they're doing it outside. So they have different times of the day where they set these up for phone calls or in person. And you bring your device, or they'll provide a device if you do show up at the school. It's a nice setting, it's outdoors. Obviously you use the school's Wi-Fi. but it's making it accessible to families to really try to understand how to access Google Classroom. And they're also providing some of the supports in Spanish. So that's important because right now, a lot of times you're seeing some support on how to navigate the platform, but it's mostly in English, or they may send a link, you know, and someone's showing you, but not the same thing as having someone present there to really help you if you get stuck and you're not sure where to click. So I really like to see that they're thinking outside the box and providing this additional support for families.
Yeah, that's great. I mean, not only is it creative in meeting the need, but I mean, again, I want to underscore this is the family's legal right to have access. It's not just you know, a nice thing to do. It's the right thing to do. This kind of leads us into the next area that I wanted to discuss, which is Iep development and implementation. And so again, communication being paramount to this area. Now, FAPE, a free appropriate public education, and the legal standard for special education is still in place. There is no waiver to FAPE at this time, but the State Department of Education has said if there are any changes made to a student's IEP solely due to the method of instruction, i.e. solely due to the fact that the school is completely virtual or hybrid or what have you, then the school is required to use a form to document that change, and that's called the Learning Model IEP Implementation Plan form. That form is also to be developed with parental input. And that can kind of document, I know SDE has come in different other public forum and explained, you know, it's not meant to be substantive change in services. It's meant to document if there is a change, maybe in environment, a change in frequency due to the way that the scheduling is, but it really shouldn't be documenting a blanket reduction in service. And so we need to keep encouraging our families to, if they think something is changing in their children's plan, ask for that, well, ask to be part of the process of developing that form, ask to see that form, and ask to discuss it through that venue.
So I'll add to that, some families are saying that they're seeing changes without having an opportunity to give input or even giving formal notice of it.
Mm-hmm. So that's, and again, I think so much of this can be addressed by communication, because I think in a lot of situations, it's not, you know, school staff trying to be sneaky or do something in a nefarious way. It's just that people are still understanding how this is supposed to roll out. So it's new to everybody. And that's what makes it all the more important as an advocacy community, that we're staying on top of things, and we're continuing to gather information from the field so we can give our parents and give those that we serve the best information. And just, I think the last kind of legal point that I want to make sure that we hit upon is parents' access to PPTs, the holding of PPTs, and the conducting of evaluations. So what are you seeing along those lines, Kiamari?
So I know that some districts are actually asking families to hold off on initial PPTs. So that's kind of concerning. I know the guidance, actually you even said Addendum 6, is saying that initials should be considered primary, like a focus. Let's work on those because they have a backlog already, and they don't want to hold off on students that may be eligible for special ed, but that is happening. And making sure that families know their rights, that they could actually have a PPT, even if it's virtual or over the phone.
Yeah, definitely. I mean, timelines are still in effect. Nothing has been changed in terms of the regular IDEA timelines and state regulation timelines. Evaluations present a trickier scenario, but the guidance still says that districts need to make every effort to conduct in-person evaluations, even if the entire district is remote. And so we're really hoping that districts, and we know, we hear stories of them being innovative and trying to come up with ways to address the needs for evaluations. And of course, an evaluation in person is so much preferable to trying to do something virtual. And we wouldn't want to encourage parents to push for that either, because that would probably, or in many cases, might affect the validity of the evaluation. I think, you know, the last two, well, let me just give you the floor back and say, is there anything else you think we should raise before we have to close out?
No, I'll share with you what I said earlier, and I'll say now here is that some families are being given a form to fill out in regards to access to a device that the child may need, and this is specific to special ed kids. And if they don't fill out this waiver of liability, saying they would be responsible or that they would purchase insurance, they're withholding the device, and I think that's concerning, right? Because if the student needs that in order to have faith. And the district is making it contingent upon filling out this form, it's compromising some families. One, some of the documentation doesn't have all the information, like how much the insurance is going to cost, the actual device listed on the form, so it seems more like a generic form, so that's kind of concerning. I know my district offered it to us. It was only $21, and I thought that was reasonable. But for some families, that could pose a hardship, so want to make sure that families know their rights. And the other thing was, it was the health one, that if they do return to school, they don't hold the school responsible if they happen to get COVID. So I know this one mom's holding onto her form. She's like, do I fill it out? Do I not fill it out? Like, what if they don't follow the protocols of keeping my daughter safe? And her daughter's nonverbal, high needs, complex. That's important to this mom. So she's like, what do I do? Do I send my kid to school? Do I fill this out? But what if something happens? And those are the big concerns. And the other thing that I say earlier, but I should say, because we spoke earlier, was the transportation. I know I've had one mom in particular say that she's seen when her child gets on the bus, other kids that are getting on the bus don't have the mask. They're not following the protocol to sit from the back, to the front, one space in between. And that there's no one monitoring the bus issue. The bus drivers just focus on driving the kids. So that also has come up in conversation.
Kimara, you're saving all this to the end. We gotta, okay, so to the first question, I think it's clear that a district cannot predicate serving a student or providing a device on the signing of any form. I think that would be our position to that. But I can understand that practically, it feels like that's the case when you walk into a school and they say, well, without that form, you're not getting this. And so that's something that we need to gather more information about and, figure out from a statewide perspective, what can be done about that. Because I think that, like you said, it's not that it's unreasonable to talk about that liability. But it definitely cannot hold up the provision of service, which is going to happen through that device. The second piece and the third piece, I'm going to save for maybe Alice and Marisa, and maybe we can talk about that at the end when we're gathering questions, and we can reiterate it then. What else do I want to say? I think that's probably it for our segment. I think that I just want to underscore, I think what you're saying about how you see families reacting and the questions they're bringing to you, just again, just shows how scared everybody is and how uncertain everybody is. And it magnifies relationships that are already, in some cases, fractured, relationships of trust that are already in disrepair. And so if you're not trusting a system that serves you, if you feel like you've been burned in the past by a system, by a state decision maker, by a local decision maker, by a district, it's really hard to feel connected to those entities now. And so I think that this situation is kind of throwing that all into the forefront. So hopefully we continue to support our families in developing relationships of trust, and we can continue to advise them to how to stand up for themselves and for their children, to develop those relationships that can withstand.
Absolutely, thank you.
Can I just jump in real quick? Dennis Wilson from Iris, hi Dennis, had a quick New Haven specific question about, they're letting in 150 special needs students starting on Monday, and sort of how do they make that decision? Keo, do you have any thoughts about that? I don't know how they're making that decision. I think it's the most severe autistic kids, and then those parents have to agree to want their kids. Is that right? And then, but I think, Dennis, maybe we should have an off this conversation with the New Haven advocates about what that's going to look like, because I already have some families who want to be part of that, and we can all maybe get together and talk about that.
And also maybe speaking directly with Tiffany because I'm sure this is more for like the self-contained kiddos. At least that was my understanding. So it's for kids of higher needs. So I think if you guys were to bring her in, you'll probably get more answers.
Okay, maybe I'll email all of us to maybe have a chat.
And this, I should just say the state does require in its guidance that districts have to consider the needs of, you know, the how to serve the highest need students, and strongly consider if they need to be in the building or receiving more in-person service even than other students, even than other special education students. So that is a separate addendum to the guidance.
Thank you. Great question, Dennis.
Yes, thank you, Dennis. And thank you both, Catherine and Keo. I just want to, as we recap here, I just want to reiterate one, I think, really important point that Keo brought up was around transportation and the challenges that families have with transportation. There's been a lot of guidance issued around students with disabilities and appropriate measures and protocols to take in schools, but we haven't seen as much around transportation. So if you have a student with a disability and there's concerns about transportation, this is an area where, you know, I think we would suggest you bring it to the PPT, to the IEP team, and raise your concerns there. And perhaps, you know, we can also push from our vantage point for some more guidance from the state for that. Thank you both very much. Hopefully we can get back to you at the end. We now turn to the final segment of our presentation, where we're going to speak about the rights of English language learners. I am pleased to introduce to you my colleague, attorney Patricia Mariale, CCA's in-house immigration and language learner expert, as well as Wendy Cardenas, senior organizer from Make Road Connecticut, which is one of Connecticut's most crucial community-based organizations representing the state's immigration population. Please remember to pose your questions in the chat. We want to hear from you. Patricia is an attorney with the Center for Children's Advocacy, and she heads up our center's Immigration Justice Project. She was born and raised in Tanzania, and she's been in the US since moving here for college. She represents children and youth who've experienced some level of abuse, abandonment, or neglect by one or both parents to obtain legal status through what's called special immigrant juvenile status in our courts. As a part of this work, she runs a pro bono network of attorneys who help to assist CCA with this work so we can reach as many children as possible in underserved areas. And she provides training for this group of attorneys, as well as many community-based Know Your Rights trainings for the legal rights of immigrants. Wendy Cardenas is a senior organizer with the Make the Road Connecticut. In her role there, she has the great task of continuing to identify and mobilize community members to organize for real change. Wendy was born in Peru, and she migrated to Connecticut when she was 12 with her family. So growing up in Fairfield County, she experienced firsthand the struggles that our community faced: lack of language access, affordable health care, access to college opportunities, and her personal fight has helped to shape the passion and advocacy she brings to her work today. So without further ado, Patricia.
Thank you, Marissa, for those introductions. And yeah, we feel really lucky to be here, to be able to talk with all of you and to just hear the different perspectives, what's been going on since COVID started. And so Wendy and I have been working together since about November of last year, specifically on just improving access to education for English language learners, or ELL is what we'll call them throughout the presentation. And we've seen a lot, the thing that's unique about this population is that not only do they face all the issues that, you know, Alice and Marietta talked about, and Catherine and Kimari talked about, but then there's that extra layer for them, is because they face all that, plus they have that barrier because of the language. And so they become a very interesting subset in all of this. And so Wendy and I are hoping to kind of talk to you and tell you about the 3 biggest issues we've been seeing and just how COVID has kind of shaped that, and then offer some suggestions and insights on some of that. And this is going to be on regards to just access to the schools and access to education. This is the breakdown on communication between the schools and the parents. And then the last kind of point is just keeping these students engaged, especially during distance learning. So Wendy, I would like to start to ask you, just like in your, because you do a lot of parent advocacy and you work with parents, what is one of the biggest obstacles that you're seeing in your work regarding ELL families and their access to education?
Thank you, Patricia, and good morning, everyone. So I've been doing parent organizing for about 5 years in Stanford and now in Bridgeport since 2017. And currently we are working on a bilingual education campaign. And with this campaign, we have been able to meet with principals, parents, teachers. And one of the biggest things that really came out of our research was that the schools are being overcrowded, right? Specifically to the 2 bilingual schools that are currently in Bridgeport, which is Batalla, Cesar Batalla, and Luis Muñoz Marin. So for example, just to give you an example, like there are like over 30 students, 30 bilingual students per teacher. So that has, for us, has been a really big issue. Another thing was that new arrivals, like students who just recently arrived to the United States, instead of being put on a bilingual program, they're put only an ESL program, which does not, fit the needs that they need. So that has been one of the biggest issues that we were able to find in this research. And we see that, we need to fix that. We need to create at least 2 more bilingual schools. So like, the overcrowdedness doesn't happen anymore.
Yeah, and I've been working with you on this work, and it's really hard. And one of the things that we have been seeing and evaluating the statutes is that they're slightly vague on the creation of bilingual programs. So like in Connecticut, if there are 20 or more students in a particular school that speak the same language, that's not English, and the school district is required to create a bilingual program the following year. It doesn't state that it has to be in that same school. It doesn't state that, so for those reasons, like for example, Bridgeport has several elementary schools, but yet only 2 of them have bilingual programs. So that's where the issue comes in, and that Wendy was talking about, the overcrowding, because parents have the option to waive out, but I mean, most parents do prefer to have their kids in a bilingual education program, especially if you're newly arrived and you don't speak the language, and you can't survive in an English only education program. So, and that's something we're hoping we can work together to kind of change in terms of the laws for Connecticut, because it really does limit the concepts that, like Catherine talked about, FAPE, like the free appropriate public education. So you can't have that if kids don't have access to education in a language that they understand. So that really undercuts their rights to education in that way. What about in terms of testing? Are you seeing any issues in that regards, and like the kids being put in the right programs? I know you mentioned a little bit about it. Can you elaborate?
Yeah, so like I mentioned before, kids do the test and they are not put in the right programs that they're supposed to be at. And also programs are very limited. There was 3 programs in the Bridgeport Public Schools for bilingual education. Cesar Batalla only has all those 3 programs, and then the other bilingual school only has two of these programs. So so I think like the testing, so far as we know, like it has stopped, at least in the 3 months that doing social distance learning. So there was no test take for the bilingual students. And then in the first 2 weeks that we have, started school, there has not been any like records of like, when are we gonna, do testing, or like, what has been like the progress of the students. So according to like, what we talked with the parents, so there has really been like, any sort of like testing so far.
Yeah. And that brings up like an interesting issue, how COVID has kind of played into all of this, because SD has issued guidance regarding testing and regarding like evaluations of new EL students. And in terms of newly arrived students, as long as the schools are operating, they're supposed to do the testing to determine their English proficiency and where they should be placed. And then also in regards of like the students that are already in the schools, as you know, that initial testing, they do like a home language survey to determine what the dominant language of a child is. And then if they determine that it's not English, then they have to do a special test called a LATSLINS. I won't get into the details of that. And then to determine their English proficiency and whether they should qualify for bilingual education or just English support. And that testing is supposed to happen throughout the year. And they're supposed to, create a report and even inform the parents, because parents do have to sign off on whether they want their kids in these programs or not. And so there's an annual reporting for this testing. And during COVID, I know they had a waiver for the spring semester, which is when it usually happens, because of COVID-19, but I mean, they're supposed to be doing these testing as soon as practically possible. I think the guidance said that in the fall, they should look towards doing any testing that wasn't done in the spring, just to make sure that students are kind of in the right programs and obtaining the right education for the school year, because that's becomes really important for that. I guess we can move on to the second topic.
So Patricia, before we move on, I want to acknowledge a few questions that were in the chat. The first question is from Bati, and Bati brings up a really challenging situation with some refugee students, and she found a bunch of these students huddled in a car outside of a school or a home trying to access education because they didn't otherwise have access. And she's wondering, is there something that can be done to ensure that students in this sort of situation have access? I don't know if you have thoughts about that. I do.
All students are entitled to education. So if the parents have registered their kids, I think most of the registration has moved online, so they should be able to register online. And I think in the next topic, we're gonna, Wendy and I are gonna talk about like device access. And that's one of the things, are the schools providing these devices? And I think Catherine kind of touched on to this. And that should be one way the schools are engaging all students. And then one of the most core principles for schools is that whatever education, whatever rights that they give to to regular English speaking population of their school, they should be providing this to English, like students with limited English abilities as well. So that should all, like these students should have access to education just as the same as any other student. And if they don't, we're welcome to work with the families to address those issues, but they should have been getting regular schooling, should have been able to register and get identified as, if they're not English speaking, whatever their native language is.
Bati just clarified that she works with Iris and she's from New Haven. I think this is something that we could definitely work with her on. I know, across the state, we've seen different districts doing innovative things like, having car dealerships create hotspots that are located throughout the city, broadcasting Wi-Fi from certain public places so that all students can have access. There's definitely some other, on an individual level, districts should be trying to assure access, and they can also, front that up by taking action like those kind of innovative things that other districts are doing. We also had a question from Dr. Robles Rivas, I believe it was, and she was interested just for Wendy to clarify where Make the Road Connecticut works and what districts you're in.
Yeah, sure. So we have offices and we work with the districts in Bridgeport and Hartford.
So actually that's a good segue, this whole conversation about access in terms of technology. We can jump right into that, Wendy. Like, what have you been seeing in terms of the schools providing technology, the right technology for parents, and how is that being implemented, and just what suggestions do you have in regards to that?
Yeah, sure. So for this specific thing, I just want to bring some parents' voices in this question. Some parents don't have the choice actually to either send their kids to school or keep them at home. I work with a lot of single moms who have to provide for their home, so they actually had to send them to school. So it's a really, really tough decision to make. Yeah, so in terms of providing the technology, the schools have been providing technology to parents who have opted to keep their kids at home. But a lot of these parents that I work with, they tell me for the first 2 days that it wasn't working. So the kids couldn't attend to the classroom. So then the other days, the parents had to go to school and say what's going on. So they got a new computer. So it has been such a hassle for them. You know what I mean? Just first of all, they have to make the decision of I have to stay at home because I want to keep my child safe and not go to school. I also have to deal with the fact that I get a computer, I have to fill up a form that I don't know what it's about, just tells me that I have to fill it out, and then it doesn't work, right? So I'm upset, I'm frustrated that I have to go back to school and deal with this again. So it's been really tough for parents, to be able to help their student and being able to also hear their voice heard, because it's been really frustrating for them. And in terms of some of the when it's actually started being able to start taking the classes, it's just they're just there. I mean, I heard from some mom that said my child's always doing this, being excited at school, going to school, but then when he sits in front of a computer, he's just tired. He's it's not the same thing. He just feels so sad of being in front of a computer. So he's not really enthusiastic to to learn. So that has been one of the things that I've heard from parents.
And so yeah, and during our conversations, we've talked about some ways that schools could do this, and I think Catherine and Kilmari also talked about some of these. It's how to keep the students engaged, and how school districts could be working with parents to provide training on how to use technology that they're requiring these parents and families to use, and also maybe providing after school programs that can reinforce learning, because we've all touched on this, is that the retention of information is not as high as it is when you're in class, when you're sitting in front of a computer and you just don't have that engagement. You don't, kids are not retaining as much. So Wendy, do you want to kind of talk about any other things that parents could do to empower themselves and in terms of accessing education for their English language learner students?
Yeah, so I think it's just a matter of parents raising their voice and speaking up on behalf of their children. It's in terms of getting involved in in work that we're doing in order to get that to have things to change in the Bridgeport school system. I think we have been doing a lot of work in terms of hosting Know Your Rights workshops with parents. We have also
like, being able to like, co-parents and giving them a space in our meetings to actually like, just talk about the frustration, what's going on with the schools. So another thing is like, we are in the middle of launching our next campaign, which our goal is to improve bilingual education. So, and we're in the middle of like, presenting our demands to the Board of Education. So like, just making sure that parents are involved and like, making sure that parents speak up when they see like things happening. They're not intimidated that, if they're going to go to the principal to complain about something, they're going to go to Board of Education members to complain about something, they shouldn't be intimidated to do that, because that's the rights of their children and their rights. So yeah, so in terms of that, that's what we've been trying to do. Yeah.
Yeah. And thank you. And just like to underscore just what Wendy has said, that despite COVID and despite the distance learning, all the rights and privileges that English language learner students had before COVID are all still in place. So schools are supposed to still be testing, schools are supposed to still be evaluating newcomers and determining their ELL, the English language learner proficiency levels, and they're still supposed to be communicating with parents in a meaningful way in terms of the programs that their children are in, and if there's going to be any exit procedures for these children to get out of any kind of language support programs, there's still supposed to be evaluations for that, and they're supposed to still be consulting with parents. This is all part of this, it's because it's with the parents and the schools together, working together. And so, and I do encourage anyone out there who has parents who are experiencing difficulties with students learning or anything, they do have a right to a PPT, as Catherine and Kiamara kind of touched on the process of PPTs. These parents can ask for PPTs if they feel like their ELL students aren't, like children are not learning appropriately or are not meeting those standards that they should since COVID had started. They can ask for a PPT to have their kids' lessons, their kids' education lesson plan evaluated, so that they're in the appropriate, they're having the appropriate education so that they can meet those minimum requirements for the state, so that they can keep advancing towards graduation. So with that, I just wanted to say thank you, Wendy, and I'll hand it back to Marissa to close us out.
Okay. Well, I want to thank you to all the panelists. And at this time, we're in a position to open things up for questions. I see here that we have another question in the chat. Let me we have somebody who's working with ECF and acknowledging that they're working with students from all over the world. Give me 1 second. She's wondering what the responsibility of the LEA is for a student that speaks a language other than Spanish. That's a good question. So what is the responsibility for, if it's a language that's not just Spanish, what is the district's responsibility for communicating and helping that student learn?
So the district has the same responsibility regardless of language. I mean, they're not required to create a bilingual program if there's 20 or less students, but they're still required to provide the student with appropriate language supports, regardless of their which language they are, if Spanish or not. And I think most districts have multiple language. They pick like 4 or 5 of the top languages, and they usually have those, the main documents translated into those languages. I mean, obviously, if a student is from a very remote part of the world and speaking a very remote language, they might not have that language, like materials in that language readily available. And, but they do provide translation services to help parents, like in terms of registration, in terms of making sure these kids are meeting those state standards. So they have the same responsibility regardless of language. It's just, the number of students might just not trigger that bilingual education piece of it. And I think the top languages are like Spanish, Creole, Portuguese and French for most districts, but it varies depending on the district.
Thank you for that, Patricia. I'm just waiting here to see if there's any other questions in the chat. I do have an additional question for, oh, we got another question. What are the different types of services that we're seeing for ELL students as well as immunocompromised students under FAPE? Are these students somehow being impeded from, is their learning being impeded from the waivers that were mentioned earlier? I think that's a good question. Catherine, I don't know if you want to take that, or Patricia.
Yeah, I'll just say the blanket statement, and then I'd love Patricia to hop on if you have anything additional to say. You know, we're still kind of wading through this. I mean, we're still kind of untangling all the different kinds of needs students have in different learning modalities. So the immunocompromised students under FAPE, I think Alice and Dr. Vasquez talked about this a little bit earlier. You know, there are situations where parents are opting to keep their children home for very important reasons. But even though there's always a virtual remote option throughout our state, there is some indication by this in state guidance that if you are opting to keep your child home, that you have to understand that you're not going to receive exactly what you would receive if you're in person. And this is a very nuanced discussion that we could kind of have further if there's specific questions. But I think the reason why that matters is because if you have a student who is precluded from going to school for these reasons, then it still could make sense for you to request homebound instruction, for example, through the same homebound instruction processes that you could request when schools are fully in person. And that is a way that a doctor would be backing up the fact that you need to stay home for various reasons, and that would encourage the district to have more understanding about the position that you're in. If I could, Marisa, should I jump on to that next question?
And
yeah,
this a little bit.
Oh, sorry.
Oh, sorry. Go ahead, Patricia. Sorry about that.
Services for like ELL students. I mean, these range, like it can be, obviously there's the bilingual ed. There can be English as a second language services. We have transitional language services, which are kind of just helping a child get out of, when they're out of bilingual ed, but still receiving like either a push in or push out with a special language teacher. And then you have like native language support systems where they complement like an ESL, that's the English as a second language program. And these are provided to the kids that are in the school system. And also like in part, as part of the COVID adaptations, since schools have been remote, I know some schools, the SD has suggested that, you know, schools provide like extra time for ELL students to complete assignments or provide tutoring for these kids that are not as engaged or potentially, so they are trying to provide extra services, especially now with COVID and the distance learning. So there are a couple, and I mean, they vary by district, but there are additional supports for these populations.
Thank you. We had one other question that is a tricky question, but maybe we can address it really briefly. We have a participant wanting to know in regards to special education, the availability of comp ed services at this point in time versus recovery services.
Yeah, I guess I have kind of a non-answer to that. I mean, folks probably know that comp ed is usually something that parents can request, and it's usually granted due to a district failing to provide IEP mandated services and or failing to failing to follow child find laws and identify students with disabilities appropriately and provide them with an IEP in a timely manner. So that's kind of how we traditionally have thought of comp ed. You know, I don't think it would be fair necessarily to put that same exact framework around kind of this COVID recovery idea, because the comp ed is more of something that is thought to be to compensate for an action or wrong action or inaction. But I do think that, you know, we are still looking to state guidance, and I guess the state is looking to federal guidance to understand more about COVID recovery services, which is a way that we can frame it that is not necessarily blaming anybody for the circumstances, but still helps us fill in some of those gaps that should be filled in.
Thank you, Catherine. We also have a really good question from Sue Tenorio, who's asking about what are legal options available to parents at this time when we're seeing these gross violations of SPED laws. I wish because we're out of time, we're not going to be able to get into that in detail, but we would certainly encourage you to reach out to us individually with these situations. I put in the chat, and you'll see on the screen in a minute the emails of our attorneys who participated today. We'd love to brainstorm with you around, you know, ways to address these violations that people are seeing. I also just dropped into the chat, or I'm trying to drop into the chat here, the State Department of Education page, which has all the pieces of guidance. And at this point, just want to take a moment to, since we have to wrap up, to thank everybody that's participated, each of our panelists today, especially our guest panelists and their organizations who took time out of their day to be here with us. Dr. Vasquez from Yale Medicine, Kiomari Sotillo from CPAC, and Wendy Cardenas from Make the Road Connecticut. Thank you very much for taking your time and making this event possible. I think we heard some themes that we should all be thinking about in our advocacy for the students that we're working with. We need school districts to be flexible. We need them to be communicating with our families. We need them to be working hard to engage our families, and we need them to be transparent. And if we're not seeing those things, we at CCA want to be a resource for you to help districts do that. Thank you again to each of you for joining us today. We will be sending out a follow-up email tomorrow morning with resources linked from this presentation. So be on the lookout for that. And this event is going to be recorded on our website, and I believe also available on CTN at some point next week. So thank you very much to everybody that's participated, and we very much appreciate your tuning in and look forward to the continued conversation with all of you.
Thank you.